Leopold'S Maneuver are 4 systematic steps in palpating the uterus through the abdomen in order to determine the fetal presentation and fetal position. It is performed after 24 weeks gestation when the fetal outline can already be palpated. Good morning, ma'am. I'm Infant Corpus, junior clerk from Davao Medical School Foundation. May I know your name? Okay. Mrs. Lolit, I'll be performing Leopold'S Maneuver to determine the position of the baby. Would you like to go to the bathroom before we start? Because it might be uncomfortable for you later during the palpation. Position the mother in dorsal recumbent. It helps the woman relax her abdominal muscles to enhance palpation. Expose only the part needed for the procedure to maintain patient's privacy. Avoid exposing the genitalia and the breast region. Warm hands to prevent tensing of the abdominal muscles. For the first maneuver, the Fundal Grip, stand at the right side of the patient facing her head and place both hands flat on her abdomen at the upper part of the fundus. Palpate the superior surface of the fundus gently to determine the consistency, shape, and mobility. This maneuver determines whether the fetal head or breech is in the fundus. Proper positioning of hands ensures accurate findings. Palpating. A head feels more firm than a breech. A head is round and hard. The breech is less well defined. A head moves independently of the body and feels ballotable. The breech moves only in conjunction with the body. Second maneuver, the umbilical grip. Face the client and place the palm of both hands on either side of the abdomen. This maneuver locates the back of the fetus. Palpate the sides of the uterus. Hold the left hand stationary on the left side of the uterus, while the right hand palpate the opposite side of the uterus from top to bottom. Then hold the right hand steady and repeat palpation using the left hand on the opposite side of the patient. This method is the most successful to determine the direction the fetal back is facing. One hand will feel smooth, hard, resistant surface, which will correspond to the fetal back, while on the opposite side, a number of angular nodulations will be felt, which corresponds to the knees and elbows of the fetus, or the fetal small parts. This is also important in determining the location where we can best hear the fetal heart tone, which is the fetal back. Third maneuver, Pollux Grip. Gently grasp the lower portion of the abdomen, just above the pubic symphysis between the thumb and index finger, and try to press the thumb and finger together. Determine any movement in whether the part is firm or soft. This maneuver determines the part of the fetus at the inlet and its mobility. If the presenting part moves upward so that an examiner's hand can be pressed together, the thumb and the fingers, the presenting part is not yet engaged. In simple terms, it is not firmly settled into the pelvis. If the part is firm, it is usually the head. Otherwise, it is breech. Fourth maneuver, Pelvic Grip. Facing the foot part of the patient, place the fingers on both sides of the uterus approximately 2 inches above the inguinal ligaments. Gently press downward and inward in the direction of the birth canal. Allow the fingers to be carried downward. This maneuver determines the fetal attitude and the degree of fetal extension into the pelvis. It should be done only if the fetus is in a cephalic presentation. If there is jutting out, fetal head is extended. When it is along the anterior side, the fetal head is flexed. Information about the infant's anterior-posterior position may also be gained from this final maneuver. After the procedure, make sure that you pull the examination gown downward to cover the patient's abdomen, and let the patient change to her normal clothes. And don't forget to thank the patient.